Welcome to my YouTube channel, Everything Medical. So today's video is all about the embryology of the respiratory system. We shall be taking a good look at the overview of the respiratory system, right? So if you are coming across to my channel at the first time, what you will do for me is to subscribe. Yes, you have to subscribe. You also comment and share our videos. It will give us a good look on what we are doing. Now let's proceed. Look at the diagram that we shall be using to discuss the overview of the respiratory system on its embryology. This diagram here depicts 5-week-old embryo showing the openings of the pharyngeal pouch and also the laryngotracheal orifice. This diagram here also is a 25 it is a 25-day-old embryo, a 25-day-old embryo, right? Showing the relationship between the laryngotrachea, the reticulum, and the stomach, right? This diagram here depicts the development of the bronchial and lung buds, which give rise to the lungs parenchyma, and also the bronchi, right? It also gives rise to the trachea and the larynx, right? So this diagram here depicts the formation of the laryngotracheal groove. That is how it works. Now, we shall be starting with the introduction. You have to understand that the respiratory system is divided into two. We have the upper respiratory tract and the lower respiratory tract. The upper respiratory tract includes the nose, the nasopharynx, and the oropharynx. While the lower respiratory tract includes the larynx proper, the trachea, the principal bronchi, the intrapulmonary bronchi, and also the lungs, right? Those are the structure that forms the lower respiratory tract. This video will majorly center on the developmental origins of the lower respiratory tract, those structures that forms the lower respiratory tract, such as the larynx, the trachea, the intrapulmonary bronchi, the principal bronchi, and also the lungs. So that is what we shall be discussing on this video, telling us the overview on how those structures that forms the lower respiratory tract get evolved embryologically, right? So that is it. Now, you have to understand that the respiratory system is purely endodermal in origin. That means it developed from the endoderm of the embryonic lining. The respiratory system developed from the endoderm of the embryonic lining, right? So it developed from the endoderm. This is the embryonic lining of the development of the respiratory system. It's embryonic what? Lining, right? Now, the respiratory system tends to develop from the median diverticulum of the foregut, called the respiratory diverticulum or the laryngotracheal diverticulum. So this is the embryonic lining where it developed from, right? Now, particularly, it tends to develop from the median diverticulum of of foregut called respiratory diverticulum, which can be called the laryngotrachea diverticulum, right? Now, this diagram here depicts all we shall be discussing. I've said it earlier, and this also. Now, let's watch here. Here is the respiratory diverticulum, which can be called the laryngotrachea diverticulum. It can be called the laryngotrachea diverticulum, right? This is the stomach, right? This is the foregut. This is the cardiac cycle. Cardiac cycle. You have to understand that the lungs, the larynx, the trachea, and the bronchi develop from the endoderm. They develop from the endoderm, right? Now, the cartilages, the muscles, and the connective tissues of the respiratory system develop from the splanchnic mesoderm surrounding the foregut. They develop from the splanchnic mesoderm. Those connective tissues, muscles, and the cartilages of the respiratory system develop from the splanchnic mesoderm surrounding the foregut. That is an important clarification that you should note about, right? Now, recall that this is the foregut also. Here is the foregut, right? This is how it developed from the embryo, right? Because this is what we call a 25-day-old embryo, showing the relationship between the laryngotrachea, the diverticulum, and the stomach. You can see that this is the foregut. This is the foregut where everything evolved from, because the origin of the development of the structures of respiratory system developed from the laryngotrachea, diverticulum, or respiratory diverticulum, right? Now, this is the foregut. Foregut, right? This structure here is what we call the respiratory diverticulum or the laryngotrachea diverticulum. Recall that I said previously that it developed from the median diverticulum of the respiratory aspect, right? It developed from the median diverticulum of the foregut per se, called respiratory diverticulum, right? So you can see it here. It is on its median aspect, right? So this is the respiratory diverticulum. Now, let's look at the development of the respiratory diverticulum or the laryngotrachea diverticulum. Let's quickly look at the development of the laryngotrachea diverticulum. Okay, This laryngotracheal diverticulum developed from an outgrowth from the ventral part of the cranial part of the foregut. Now you can see this is the foregut, right? Here is the foregut. So it developed as an outgrowth, right? You can see as an outgrowth, something that like a growth, right? It developed from as an outgrowth on the ventral part of the cranial part of the foregut. You can see ventral means what? Anterior. Cranial means towards the head region, which is superior aspect. You can see that it developed from the anterior aspect of the superior part of the foregut. That is what it means by the ventral part of the cranial part of the foregut. This is the foregut, right? This is the respiratory diverticulum or the laryngotracheal diverticulum, right? So it usually appears like an outgrowth, which is what we call the respiratory diverticulum. It usually appears like an outgrowth from the ventral part of the cranial part of the foregut. You can see it on this diagram, right? You can see it here. So ventral means anterior. Cranial means towards the head region, right? Which is superior, right? So that is how it works. So this remains our foregut. This is what we call tracheoesophageal fold. It leads to the development of the tracheoesophageal septum, which separates the laryngotracheal diverticulum from the esophagus. As we proceed, you get to know that more better. So this is what we call tracheoesophageal fold. Tracheoesophageal fold. This remains the respiratory diverticulum. Right? Now, that is how it works, right? It develops as an outgrowth from the ventral part of the cranial part of the foregut. Now, the respiratory diverticulum, which can be called the laryngotracheal diverticulum, usually appears as a midline groove. It usually seen like a midline groove, which can be called the laryngotracheal groove. Now watch. This is what we call the midline groove or the laryngotracheal groove. Because this diagram depicts the development of the laryngotracheal groove, which leads to the formation of the laryngotracheal diverticulum, which is where the respiratory structures evolve from. Laryngotracheal groove, right? So it's usually seen on a midline. It's usually seen as a midline groove or the laryngotracheal groove on the endodermal lining, on the what? Endodermal lining of the floor of the primitive pharynx, just caudal to the hypobranchial eminence, precisely the epiglottal swelling. Now what? You can see that this structure that is here is called the hypobranchial eminence. The hypobranchial eminence, right? It is a structure that it is usually seen on it what? Towards the primitive pharynx. That is the caudal aspect of it towards the down aspect of it, right? Because the laryngotracheal groove is found on the endodermal lining on the floor of the primitive pharynx, caudal, that is below to the hypobranchial eminence, but precisely the epiglottal swelling during the 4th week of the intrauterine life, that is IUL, the life in the womb, right? So this is what we call the epiglottal swelling. Epiglottal swelling. You have to understand that the development of the laryngotracheal groove is so essential for the formation of the laryngotracheal diverticulum, right? Because the laryngotracheal groove is usually seen on the midline as a midline groove, right? On the endodermal lining towards the floor of the primitive pharynx, just caudal below, just caudal. Caudal means below, right? Inferior. So just caudal to the hypobranchial eminence, but particularly the epiglottal swelling during the 4th week of intrauterine life. Now, the laryngotracheal groove is flanked. The laryngotracheal groove is flanked by the 6th pharyngeal arch. This is the 6th pharyngeal arch. By the 6th pharyngeal arch. 6th pharyngeal arch is usually flanked by the 6th what? Pharyngeal arch. Once it is being flanked, right, it deepens the groove to form a longitudinal diverticulum called the respiratory diverticulum or laryngotracheal diverticulum. That is how the formation of the laryngotracheal diverticulum forms from the development of the laryngotracheal groove, which is a groove that is found on the midline. This groove is so essential for the formation of the laryngotracheal diverticulum, so that the respiratory structures can be fully developed, right? These are the pharyngeal arches, right? But the one that flanked the laryngotracheal groove is the 6th pharyngeal arch. Once it flanks it, right, it deepens the groove. The groove got what deepens, right? So that it will form a longitudinal diverticulum called the laryngotracheal diverticulum or the respiratory diverticulum, right? So this is what we call foramen caecum. Foramen caecum. These are the 2 lingual swelling. The 2 lingual swellings. The 2 lingual swelling. This is what we call trabeculum impar. The trabeculum impar. There is a swelling here called arytenoid swelling. So we have seen that we have developed our laryngotracheal groove, which is a groove that is found on the midline, on the endodermal lining of the floor of the primitive pharynx, caudal to the hypobranchial eminence, particularly the epiglottal swelling during the 4th week of the uterine life. Now, this groove is flanked by the 6th pharyngeal arch. As it flanks it, the groove becomes deepened. Once it deepens, it forms a longitudinal diverticulum called the laryngeotracheal diverticulum. So that is how it's being formed. Now, you have to understand that the laryngeotracheal diverticulum is separated from the oesophagus by the tracheoesophageal septum. By the tracheoesophageal septum, right? This remains the foregut, right? Now, this is oesophagus. This is what? Oesophagus, right? Because this remains our respiratory diverticulum or the laryngeotracheal diverticulum, right? Because the laryngeotracheal diverticulum is separated from the oesophagus. That is its distal aspect. The distal aspect of the respiratory diverticulum is separated from the oesophagus by the tracheoesophageal septum, right? This is the tracheoesophageal septum. This is the tracheoesophageal septum, right? This remains the respiratory diverticulum. This remains our oesophagus. Now, I repeat, the respiratory diverticulum is separated. It is separated. That is its distal aspect. The distal aspect of the respiratory diverticulum is separated from the oesophagus by the tracheoesophageal septum, right? Now, the cranial aspect of the respiratory diverticulum continues to communicate with the pharynx, right? It continues to communicate with the pharynx. As it continues to communicate with the pharynx, it creates an inlet called the laryngeal inlet. It creates an inlet called laryngeal inlet. This inlet was created by the cranial aspect of the respiratory diverticulum. As it continues to communicate with the pharynx, it creates that inlet called the laryngeal inlet. So that is how it is being what? Formed, right? This remains our respiratory diverticulum. Respiratory diverticulum. This remains our foregut. Now, here is what we call the fusion of the tracheoesophageal fold, because it fuses to form the tracheoesophageal septum that separates the respiratory diverticulum, that is the distal aspect of the respiratory diverticulum, from the oesophagus. As you can see it here, this is how they form. This is how they begin to form. Here is tracheoesophageal fold, right? As it gets to this state, it fuses in order to form the tracheoesophageal septum. So this remains our respiratory diverticulum, right? This remains our tracheoesophageal fold because it fuses to form the tracheoesophageal septum, right? Now, the tracheoesophageal septum is formed by the two lateral folds called the tracheoesophageal fold. This tracheoesophageal fold usually grows medially. So two of them fuses on a midline to form this septum, right? So it grows medially together, right? Like together. The fuses on the midline to form this septum called tracheoesophageal septum, which separates the distal aspect of the respiratory diverticulum from the esophagus. That is how it works. Now, the respiratory diverticulum will grow downward to the thoracic cavity. Once it grows downward to the thoracic cavity, it becomes bifid to form two right and left bronchia and lung buds, right? Because it grows downward towards the thoracic cavity to form two right and left bronchia and lung buds. Look at it here. Look at the two here. Right? Bronchia and lung bud. Right? Now, the part of the respiratory diverticulum that is proximal to the bifurcation, as how it bifurcates, chooses to form the larynx and the trachea, because the part of this structure as a whole, is called respiratory diverticulum. Diverticulum, right? The part of this respiratory diverticulum that is proximal to the bifurcation, which forms the right and left bronchia and lung bud, chooses to form the larynx and the what? And the trachea. That part forms the larynx and the trachea. Whereas the bronchial bud forms the bronchi and the lung parenchyma. Bronchial bud forms two structures, the bronchi and lung parenchyma, right? Okay. Now, each of these lung buds invaginate into the pericardioperitoneal canal. Each of these lung buds, the right and left of them, invaginate into the pericardioperitoneal canal, right? Now, the right and left pericardioperitoneal canal chooses to form the right and left pleural cavity, respectively. That means the lung bud forms the right and left pleural cavity. Forms the right and left pleural cavity. You have to understand that this bronchial and lung bud was formed as a result of the downward growth of the respiratory diverticulum as it enters the thoracic cavity. Once it enters them, it develops the right and left bronchial and lung bud. Now, the part of the respiratory diverticulum that is proximal to the bifurcation that leads to the formation of these structures forms the larynx and the trachea, whereas the bronchial bud forms the bronchi and the lung parenchyma. Now, the lung bud chooses to form the right and left pleural cavity because the lung bud invaginates into the pericardioperitoneal canals. Now, the right and left pericardioperitoneal canals form the right and left pleural cavity. So these are the structures that forms the lower respiratory tract. This is how they develop. In my next class, I will start with the development of the larynx and the trachea, because today's class is all about the overview on how those structures, the larynx, the bronchi, the trachea, the lungs, got what? Develop. Okay. This remains the brain. The brain. This remains the brain. This remains the opening of the pharyngeal pouch. Openings of pharyngeal pouches, right? This remains the opening of the laryngotrachea orifice. Opening of laryngotrachea orifice. This is openings of pharyngeal pouch, right? Here remains the pleural cavity. Pleural cavity. This remains the buccopharyngeal membrane. The buccopharyngeal membrane. Right? Because that this is our oesophagus. Also, we have indicated it. So, this is how the development of those structures that forms the lower respiratory tract got evolved, right? As you can see, that the bronchi and the lung parenchyma developed from the bronchial bud, because as the respiratory diverticulum enters the thoracic cavity, it becomes beefy to form the right and left bronchial and lung bud, right? The lung bud, because there are two, right? Now, the lung bud chooses to invaginate into the pericardoperitoneal canals to form the right and left pericardoperitoneal canals. The right and left pericardoperitoneal canals form the right and left pleural cavity, which covers the right and left lungs, right? That is how they are being formed. You have to understand that the respiratory diverticulum developed from the median portion of the foregut, right? That is why it usually appears like an outgrowth on the ventral part of the cranial part of the foregut. So the whole origin of it is from the foregut, giving off the respiratory diverticulum or the laryngotrachea diverticulum. Recall that it is purely endodermal in origin, right? So that is all about the overview of the development of the respiratory system. In my next video, I will be treating the development of the larynx and also the trachea, because we have given an overview on how it is formed, right? We shall start from those parts, because in larynx, the larynx is being formed by the portion of the respiratory diverticulum that is proximal to the bifurcation of the respiratory diverticulum to form the bronchia and the lung bud. That part that is proximal to the bifurcation forms the larynx and the trachea, right? You have to understand that I've said previously that the structures such as the cartilages, the connective tissues, and the muscles of the respiratory system develop from the splanchnic mesoderm. They do not develop from the what? From the endoderm. So that is how it is being formed. I believe you enjoyed the class. Thank you so much for staying to the end of this class. I really appreciate it.